Bismillahirrahmanirrahim. Assalamu alaikum. My name is Fiza Ahmed. I am student of BTS first year. So today my topic is the trigeminal nerve, which is the fifth cranial nerve, and there are total three branches of the trigeminal nerve: ophthalmic nerve, maxillary nerve, and the mandibular nerve. The first two nerves of this trigeminal nerve are sensory in nature, and the mandibular nerve is a mixed nerve. Now I will explain the course of the trigeminal nerve. Here is the brain stem, and these are three parts of the brain stem: the midbrain, then the pons, and the third one is the medulla oblongata. There are two roots of the trigeminal nerve. The first is the sensory root, which move forward and give rise to the ganglion known as the trigeminal ganglion. Trigeminal ganglion is basically a collection of the nerve cell bodies, and it lies outside the CNS. And from the trigeminal ganglion, there is the arousal of the three axons, which will form the three nerves, namely the ophthalmic nerve, the maxillary nerve, and the mandibular nerve of the trigeminal nerve. And the second root of the trigeminal nerve, which arises from the pons, is the motor root, which accompany the sensory root of the mandibular nerve. So that's why the mandibular nerve is the mixed nerve, and through the foramen ovale it leaves the skull. In this video I will tell about the course and the distribution of the maxillary division of the trigeminal nerve, as I have explained the ophthalmic division of trigeminal nerve in my previous video. So as the maxillary nerve move forward, it enters the middle cranial fossa, and within the middle cranial fossa is the presence of the cavernous sinus, and the maxillary nerve will enter the lateral wall of the cavernous sinus, and after leaving the cavernous sinus it will enter the foramen known as the foramen rotundum, through which it will leave the skull and enter the inferior orbital fissure. Inferior orbital fissure is basically the same as the superior orbital fissure. The main difference is that it is present in the inferior side of the orbital cavity, and the canal of the inferior orbital fissure is known as the inferior orbital canal, and through the inferior orbital fissure the maxillary nerve will enter the inferior orbital canal, and after leaving the inferior orbital canal it will give its different branches. Here is the presence of the ganglion known as the pterygopalatine ganglion between the foramen rotundum and the inferior orbital fissure on the maxillary nerve. As the maxillary nerve entered the inferior orbital canal, it becomes the inferior orbital nerve. Basically, the inferior orbital nerve is same as the maxillary nerve. It is just a continuation of the maxillary nerve. And there are three important nerves division or the branches of the maxillary nerve, which are given to the palate and the teeth. Just inferior to the inferior orbital canal is the presence of the palate, and the first nerve which arises from the maxillary nerve uh, is between the foramen rotundum and the pterygopalatine ganglion, and this is the main branch and the direct branch of the maxillary nerve, and the two other branches arise from inferior orbital nerve, and they also innervate the middle and the anterior part of the palate, and given a name as posterior superior alveolar nerve, the middle superior alveolar nerve, and the anterior superior alveolar nerve, and the direct branch of the maxillary nerve is only the posterior superior alveolar nerve. So here we are done with the course and the branches of the maxillary division of the trigeminal nerve. Thank you.